Hi Shannon. Hi, my name is Montana. I'm one of the nurses here. So I was just told that the doctor prescribed you cholestyramine.
Mm-hmm.
Did he tell you anything about that medication? Do you know anything about it?
No.
Oh, okay. So I'll just take a few minutes to let you know what it does in your body, okay?
Okay.
So feel free to ask questions at any time. So you have high cholesterol levels, and that's also called hyperlipidemia. So this medication helps get rid of some of the bad cholesterol in your body. So as you probably know, cholesterol comes from your diet, but it is also comes from your liver. So this drug works in your liver. The liver turns cholesterol into bile acids, and then it sends it to the intestines, and your body breaks it down and turns it into feces and removes it from the body. So this drug attaches to the bile acid in the intestines and causes the liver to make more bile acid. So as the liver makes more bile acid, it also is getting rid of more cholesterol. Does that make sense?
Mm-hmm.
Okay. So it lowers the amount of cholesterol in your body because your liver is turning more cholesterol into bile and then getting rid of it as a waste. So do you have any questions for me about that?
No.
Okay. So on top of that, we can also talk to your provider about using diet and exercise as a way to lower cholesterol levels, and maybe we can get you in touch with a dietitian to talk about like your diet and everything, because that also is a big part of it. But hopefully this medication will help, and we'll be meeting back in 2 weeks to see how it's doing. So
Okay. Thank you.
You're welcome.
So some of the side effects that you might experience are nausea, vomiting, constipation, gas, and stomach discomfort. Some of the more serious ones you want to look out for are pain in your stomach, unusual bleeding and bruising, rapid breathing, and confusion. So if you have any of those, you're going to want to call your doctor. And can you just repeat those back to me?
Nausea, vomiting, constipation, abdominal discomfort, and then unusual bleeding, bruising, rapid breathing, confusion.
Okay, great. Just wanted to make sure that you understand this.
Mm-hmm.
And then while you're taking this medication, it's going to come in a powder form. You're going to put that into a cup of water or whatever you want, like a soup, applesauce, doesn't matter. You're going to stir it in. You're going to make sure you have at least 2 to 6 ounces of liquid. And then once you're done with that, you're going to rinse the cup with more fluid and then drink that to make sure you got it all. And to avoid your stomach getting upset, you probably want to take it before when you're eating a meal. Don't keep the medicine in your mouth for a long time either, because your teeth might get discolored. So the way that cholestyramine works, it may decrease the effectiveness of some other medications that you take. So you want to take your other medications at least an hour before you take cholestyramine or 4 to 6 hours after. And make sure you take it every day, even if you feel okay, because you're not going to feel any symptoms due to high cholesterol, but your body's going to feel it. Do you have any other questions?
No.
Okay, so I put together this packet for you with all the information. You can read it over, and the number's on there if you need to call, and yeah, that's it.
Thank you. As the first nurse, I explained the pharmacology of cholestyramine using simple terms that the patient would understand. I gave the patient alternative methods to help reduce her cholesterol by using diet and exercise, and referred her to a dietitian for additional information. I asked if she had any questions about the information provided frequently.
The method of education that I used was teach back. After reading the side effects to the patient, I asked her to repeat them back to me. She was effectively able to remember what I had told her and was able to repeat them back. She knows what adverse effects to look out for and when to call her provider. Since her medication requires a different type of ingestion than usual, I was able to teach her how to take it as well. She now knows how to take it properly and when she should take it. I also advise her to take it every day, even if she feels that she doesn't need to, since people with high cholesterol usually don't feel any symptoms. It is important that she does this.